Hey there, and welcome. If you're a new parent, you already know that bringing home a baby is amazing and also, well, a little terrifying. There are so many questions, right? So today, we're going to cut through all that noise. This is your clear, simple playbook for newborn care, all based on expert advice for those super important first few months. Okay, let's get right into it. First off, if you're feeling overwhelmed, you are not alone. It is completely normal. The amount of information out there is just staggering, and all you want is to do the right thing for your little one. But here's the good news. It's actually way simpler than you think. This isn't about having all the latest gadgets or memorizing some giant textbook. And that really is the core message for today, coming straight from pediatrician Dr. Mahesh Yadav. You see, the real foundation for a healthy, happy baby isn't about being perfect. It's about creating simple, loving, and really consistent routines. So, what's the big secret then? Well, it all boils down to one word: predictability. Think about it. A predictable routine makes your baby feel safe and secure in this big new world. And that feeling of safety is absolutely crucial for their development, physically, emotionally, and even for their growing brain. So that's what we're going to do. We're going to break down these small, powerful routines into steps you can actually follow. We'll cover everything from feeding and sleeping to knowing exactly when it's time to pick up the phone and call the doctor. All right, let's dive into the absolute essentials. These are the building blocks of your day-to-day life with your new baby. These are the things that are going to become the backbone of your routine. We're going to look at this in three key areas. First up, the rhythm of feeding and burping. Second, the absolute non-negotiables of safe sleep. And third, all those little daily things that promote wellness and help you build that incredible bond with your baby. Okay, feeding. The number one rule here is to respond to your baby, not the clock. You want to watch for those early hunger signs, when they start turning their head looking for the nipple, making little sucking motions, or bringing their tiny hands to their mouth. And remember, for those first 6 months, breast milk has everything they need. All right, here's a question for you, and the answer might actually surprise you. After your baby's done eating, how long do you really need to keep them upright for burping? Is it 5 minutes? Maybe 10? What do you think? The magic number is 15 minutes. Now, what's so important about this is that even if your baby lets out a huge burp in the first 2 minutes, you still want to keep them upright for that full 15. It really helps their whole digestive system work better, and it helps prevent all that gas, discomfort, and spitting up. Okay, now for something that is absolutely critical: safe sleep. These rules are not suggestions. They're here to protect your baby. It's always on their back, on a firm mattress, with absolutely nothing else in the crib or bassinet. No pillows, no blankets, no stuffed animals. Room sharing is a great idea, but bed sharing is not recommended. Just remember this: a bare crib is a safe crib. So beyond just feeding and sleeping, your daily routine has these other little wellness boosters. Simple things like washing your hands before you touch the baby. That's huge. A little bit of indirect morning sunlight, maybe 10 or 15 minutes, is great for vitamin D. And don't ever underestimate the power of connection. Talking, smiling, skin-to-skin contact, all of that is literally building your baby's brain. And speaking of vitamin D, a supplement is pretty much the gold standard for their first year. All right, we've talked a lot about what to do. But you know what's just as important? Knowing what not to do. So let's run through some common things that every new parent really needs to avoid. So let's put these side by side. On the do list, definitely follow that vaccination schedule. But on the never list, no honey, no water, not even gripe water before 6 months. A gentle massage? Wonderful. But you must never, ever shake a crying baby. Keep swaddling them correctly and breastfeeding, but keep those pillows and loose bedding out of the crib and avoid bottles unless your doctor specifically says you need them. Knowing all the day-to-day stuff is great for your confidence, but it is just as critical to know the red flags. So let's cover the clear signs that mean you need to stop what you're doing and get professional medical help right away. Okay, this is a number every parent should burn into their memory. A rectal temperature of 104 degrees Fahrenheit or 38 Celsius in a newborn is considered a medical emergency. Don't second guess it, don't wait, call your doctor immediately. And beyond a fever, you really have to trust your gut. If you see any of these things, if your baby just keeps refusing to eat, if their breathing seems really fast or their chest is pulling in, if they're just impossible to wake up, if they're vomiting over and over, not having many wet diapers, or if their skin is getting really yellow and it's spreading down their body, all of those are reasons to make that call. So let's bring it all home. Look, the goal here isn't to be a perfect parent. That doesn't exist. The goal is to be a confident parent, and I promise you, you have everything you need to give your baby an amazing start in life. And let's finish right where we started. If you take away just one thing from all this, let it be this. Your simple, consistent, loving care is the most powerful tool you have. It's the foundation for literally everything: their health, their growth, and their feeling of being safe and loved in this brand new world. So, what's one simple thing you can start doing today? It doesn't have to be some huge change. Maybe it's just committing to that full 15 minutes of burping time, or maybe it's starting a little daily skin-to-skin ritual, or even just making sure the crib is totally clear. Confidence begins with one small, simple step. You've got this.